How do I know my kidneys don't work properly? Hi guys, I'm continuing from the previous episode of functions of the kidney, everything about kidney. This is part 2. So today we are going to talk about how to know if your kidneys are not working properly and some causes of kidney diseases. Okay, so if you've not been following me, please follow and put on the notification. Okay, so today, how do you know your kidneys don't work properly? So most times you do not know your kidneys are failing. Sometimes you do not know your kidneys have problems. So, but it could be picked up on just a normal blood test. You could even have malaria, you go for blood test and they decide to check. They say we want to do FBC, we want to do CRP, and then once they mention we want to do electrolyte, urea and creatinine, there they get it. Once they take your blood and test for, we call it U&E here, but in Nigeria, I know they call it EUCR. That's electrolytes, urea and creatinine. So I know when I was working there, we call it EUCR, and that is what will appear on your lab test, paper. So but here they just say U&E. So once they mention U&E or EUCR, that's kidney function. So if you have a problem with your kidney, it's going to pick it up. If it's not clearing urea, they're going to pick it up. They will see the level of urea. If it's not clearing creatinine, they will see creatinine level. All right. So your regular blood test or blood check could actually tell you if you have kidney concerns. I call it concerns because it's not confirmed what the problem is. You get? So once you get there, they'll check the EFGR. I don't know, it's like estimated glomerular filtration rate. I think that's what that terminology is. And it's supposed to be 100. Your kidney should perform well, right? If you're healthy, if you are all right, your kidney should perform at its maximum. But when they start getting, sometimes you see 9, you see 5. OT law, kidney don't buy. You get? So what are the causes of these kidney diseases? Because okay, I wanted to say causes of kidney diseases. People with diabetes, sugar problem, diabetic people, they are prone to kidney diseases and pancreas whatever, because it has the kidney has to regulate the pancreas, the insulin intake and all of that, so it affects the kidney as well. So they'll have problems. They might have problems. It's not like everybody who is diabetic will end up having kidney issues. Okay, so and then blood pressure. People with high blood pressure, unregulated, let me mention it that way. Some people have high BP. It's not even diagnosed. They don't even know they have it. You get? So, but if it's diagnosed already, your medications, you are compliant to your medications, thereby keeping the blood level at the barest minimum, you get, or at the barest maximum, since it's already high, you might reduce your chances of coming down with kidney diseases and other issues that has to do with that. And then sometimes we found out that it is in some ethnic groups. It runs in families as well. It can be genetic. You will just see that your first cousin had kidney failure. The other uncle's child also has. So if you trace your lineage, like at one point or the other, somebody is coming down with kidney disease. I've seen it here. Okay, so and you find out that two cousins are coming for dialysis, and their mom, their late mom, was also coming for dialysis. So you see that it runs in families as well. So certain types of inflammations could cause kidney damages, glomerular damages. You know, the cells that does the actual filtration could have some issues and is no longer working, or is swollen, is inflamed. So all those little pores, all those little holes that those macro whatever elements or macro products or micro products are supposed to pass, they're stuck, so your body can't take it out. So kidney stones can also damage your kidneys. I've talked about infections. Have I talked about it? Okay. Untreated or repeated infections of the kidney, like pyelonephritis, could cause it. It could even cause a permanent damage. UTI, urinary tract infection. You will say, okay, urinary tract infection is going to be ascending. It will ascend through your, you know, if it happens, your bladder is there. From your bladder, it could ascend up to your kidneys. So untreated urinary tract infections could cause kidney failure or kidney disease. What did I call it? Bladder stones. Yeah, bladder stones or kidney stones can also damage your kidneys. And sometimes you find it in people who don't drink water. So all those products, they become calcified, becomes like, you know, become chalky, become like stones, something that water should have, or no, enough fluid in your body should have washed off. You're not drinking. People say, I don't like water, I don't drink water. Those things become calcified and become stones. There are medications that could dissolve stones, but you don't even know you have them, so they end up damaging your kidney. All right, so kidney disease can gradually come up, or it can just happen like acutely. Do you get? It can happen acutely. You can just get sick and you find yourself in the hospital and they found out your kidney has failed. All right, so far I've been able to say how to know your kidney is not working properly, and the test that is done to dictate kidney problems or kidney concerns. And then I've also talked about some of the factors that causes kidney diseases. All right, so thank you for watching. In my next video, I'm going to be talking, you know, what happens if your kidney fails. Is there any treatment? What are the treatment options? What are the things you should do? And then even before then, okay, maybe the next one I should also do signs and symptoms, like signs and symptoms. All right, so thank you for watching this movie. If you've watched, I say movie, if you thanks for watching this video. If you've watched this, please give a thumbs up, share your thoughts, comment, like, share this video, let it go viral, let it get to people, let people get this is common knowledge that you're having for free, just your data. Thank you for watching. Bye. See you in my next video.